Now I'm going to talk about having undifferentiated connective tissue disease, UCTD for short. To begin with, it's an autoimmune connective tissue disease, which means your body sees its own tissues as foreign and attacks them, specifically tissues containing collagen. That's what a connective tissue disease is, an autoimmune disease that attacks collagen. Now, collagen is present in, all throughout the body and pretty much everything. You've got it in your skin, your joints, your internal organs, you name it, it's probably there. UCTD is kind of the generalized connective tissue disease, so to speak, because it's not one of the specific ones like lupus, scleroderma, rheumatoid arthritis, things like that. It's kind of one that you could say hasn't shown its true face yet, until it differentiates, if it differentiates. Some never do. I don't know if mine will or not. There's no certainty in predicting that. I think my rheumatologist is trying very hard to keep that from happening, and I'm trying very hard to cooperate. Basically, it is a form of arthritis. I get a lot of joint pain. Pretty much every joint in my body hurts, including some you wouldn't think of, such as where the ribs connect to the sternum. That's pretty painful. I get pain in the joints in my feet, not just my toes, but if you follow your big toe further up your foot, you'll find about midway a joint. I get a lot of pain in that in both feet. My hands, I get a lot of pain. Sometimes my fingers swell. I get a lot of pain in my knees, especially my right knee. My right knee is pretty much always slightly swollen. I can't think of a joint that isn't affected. My joints aren't deformed, but they do swell, and there's constant pain. The only relief I ever get from pain, really, is when I do manage to sleep. Even taking Vicodin at night to ease the pain. I think I'm on the second lowest dosage of Vicodin, 7.5, and it really, it does take the edge off, but it doesn't make it go away. It was hard for me to go on narcotics, really. And it has Tylenol in it, and I don't do very good with Tylenol. If I take Tylenol on its own, or if I take too much of anything with Tylenol in it, I'll vomit. So I think I'm going to ask my rheumatologist about the kind of Vicodin that actually comes with ibuprofen. It's actually a different name. I don't think it's said Vicodin. It's like something else, I think. But back to UCTD. Sometimes you can have features that would show up in specific connective tissue disease, like some people get the malar rash across the face, across the nose and cheeks, that people with lupus have. You might be able to get some of the features of scleroderma, but I don't think you can get too many of them, because if you get too many of them, you're probably looking at a limited diffuse form of scleroderma known as CREST. That stands for 5 things. I'm not going to go into that in this video. Let's see, sometimes I get vascular rashes. I have telangiectasias. Sometimes I get not sure I'm going to pronounce this right, petechia? I'm not sure which it is. It's kind of like little pinpoint purpura. Telangiectasia is really enlarged blood vessels, enlarged capillaries. Petechia, which I think is how it's pronounced, is actual pinpoint-sized dots where you're bleeding beneath the surface of your skin. And they can look similar, but I find for myself, actually a redhead, that being light-skinned, what I notice is that telangiectasias tend to be kind of reddish, and petechia tend to be kind of reddish purple. Telangiectasias blanch if pressed on. I don't think petechia do. I'm 100% sure there. I'm pretty sure they don't. I get sometimes very large vascular rashes about this round. Gotten them on my legs. I tend to bruise for really no apparent reason. I think that might be though because I don't have a genetic connective tissue disease known as Ehlers-Danlos, but I kind of almost have it, so to speak, in that my connective tissue is genetically weak. Sometimes I think that's the one thing that keeps me from differentiating into scleroderma. So that might be why I bruised, because essentially my tissues are too soft and, you know, they won't take anything. I don't think what else to say about UCTD. I get digestive problems with it. I have GERD, that's gastroesophageal reflux disease. I have Raynaud's, which means that my fingers and toes, nose, ears, various other body parts are very sensitive to cold, and the blood stops flowing. They turn like, people say it's the red, white, and blue disease or syndrome, Raynaud's, because it's when your blood first, the flow stops flowing or slows down, your fingers will turn white, then they'll turn blue when they're completely cyanotic, when there's like almost no blood flow. Although for me, they turn purple, not blue. And then they'll turn red when your blood starts flowing again. There's a few other things people with UCTD experience, but it really varies from person to person. Like I said, it's really just the generalized connective tissue disease.